In the high-stakes world of emergency medicine, every second counts. Lives hang in the balance, demanding swift and decisive action from healthcare professionals. Among the critical tools at their disposal are emergency drugs, powerful medications capable of reversing life-threatening conditions. These drugs are not a magic bullet, but a lifeline when administered correctly and promptly. They can jumpstart a stalled heart, reverse a dangerous allergic reaction, or even bring back someone from the brink of an opioid overdose. Their importance cannot be overstated. This essay will delve into the world of emergency drugs, exploring their uses, indications, and contraindications. We'll focus on 10 key drugs, providing a concise overview of their mechanisms and the situations in which they are most effective. Whether you're a seasoned healthcare provider or a student just beginning your medical journey, understanding these drugs is paramount. Epinephrine, often referred to by its brand name EpiPen, is a cornerstone of emergency medicine. It's the go-to treatment for anaphylaxis, a severe and potentially fatal allergic reaction. When administered quickly, epinephrine can be the difference between life and death. Epinephrine works by constricting blood vessels, relaxing airway muscles, and reducing swelling. This triple-action mechanism helps to combat the life-threatening symptoms of anaphylaxis, which can include difficulty breathing, a drop in blood pressure, and cardiovascular collapse. Indications for epinephrine are clear. Any signs of anaphylaxis, such as hives, swelling of the face or throat, wheezing, or difficulty breathing, warrant immediate administration. However, caution is advised in patients with heart disease, as epinephrine can increase heart rate and blood pressure. Always prioritize airway management and cardiovascular support alongside epinephrine administration. Amiodarone is a powerful antiarrhythmic drug used to treat life-threatening heart rhythm disorders, particularly ventricular tachycardia and ventricular fibrillation. These conditions disrupt the heart's normal electrical activity, leading to ineffective pumping and potentially cardiac arrest. Amiodarone works by blocking abnormal electrical signals within the heart, helping to restore a normal heart rhythm. It's typically administered intravenously in emergency situations, allowing for rapid onset of action. While highly effective, amiodarone has potential side effects, including low blood pressure, slow heart rate, and lung problems. Therefore, it's crucial to monitor patients closely after administration. Always consider the risks and benefits, especially in patients with pre-existing heart or lung conditions. Atropine is an anticholinergic medication that blocks the effects of acetylcholine, a neurotransmitter that slows heart rate. It's a first-line treatment for bradycardia, a condition characterized by an abnormally slow heart rate that can lead to dizziness, fainting, and even cardiac arrest. By blocking acetylcholine, atropine increases heart rate and improves electrical conduction within the heart. This helps to restore a normal heart rhythm and improve blood flow to vital organs. Atropine is generally safe and well tolerated, but it can cause side effects such as dry mouth, blurred vision, and urinary retention. It's essential to monitor patients closely for these effects, especially in elderly patients and those with underlying medical conditions. Section 5. Adenosine. A brief pause for the heart. Adenosine is a unique drug that briefly pauses the heart's electrical activity. It's used to treat supraventricular tachycardia or SVT, which is a type of fast heart rhythm that originates in the upper chambers of the heart. Adenosine works by slowing conduction through the atrioventricular node or AV node, which is the electrical gateway between the upper and lower chambers of the heart. This brief pause allows the heart to reset its rhythm, often converting SVT back to a normal sinus rhythm. Adenosine is administered as a rapid intravenous push, followed by a saline flush. Its short half-life means its effects are fleeting, typically lasting only a few seconds. Common side effects include flushing, chest discomfort, and shortness of breath. Section 6. Magnesium Sulfate, a multifaceted electrolyte. Magnesium sulfate is an essential electrolyte with a wide range of uses in emergency medicine. It plays a crucial role in muscle and nerve function, blood sugar control, and blood pressure regulation. In emergency settings, magnesium sulfate is commonly used to treat seizures associated with eclampsia, a serious complication of pregnancy characterized by high blood pressure and protein in the urine. It's also used to manage torsades de pointes, a life-threatening heart rhythm disorder. Magnesium sulfate can cause side effects such as flushing, nausea, and muscle weakness. In high doses, it can lead to respiratory depression or cardiac arrest. Careful monitoring of vital signs and reflexes is essential during administration. Section 7. Sodium bicarbonate restoring pH balance. Sodium bicarbonate, commonly known as baking soda, is an alkalinizing agent that helps to restore the body's pH balance. In emergency medicine, it's used to treat severe metabolic acidosis, a condition where the blood becomes too acidic. Metabolic acidosis can occur in various situations, including severe dehydration, kidney failure, and diabetic ketoacidosis. Sodium bicarbonate works by neutralizing excess acid in the blood, helping to restore a normal pH balance. Sodium bicarbonate is generally safe when administered appropriately, but it can cause side effects such as fluid overload, electrolyte imbalances, and metabolic alkalosis, which is the blood becoming too alkaline. Careful monitoring of electrolytes and acid-base status is crucial. Section 8. Naloxone reversing opioid overdoses. Naloxone, often recognized by its brand name Narcan, is a life-saving medication that reverses the effects of opioid overdoses. Opioids such as heroin, fentanyl, and prescription pain relievers can cause respiratory depression, leading to coma or even death. Naloxone works by blocking opioid receptors in the brain, reversing the effects of the overdose and restoring normal breathing. It's available as an injection or a nasal spray, making it easy to administer in emergency situations. Naloxone is a crucial tool in combating the opioid epidemic. It's essential for first responders, healthcare providers, and even members of the public to have access to naloxone and be trained in its administration. Section 9. Conclusion. Emergency preparedness, a vital skill. Emergency medicine is a demanding field that requires quick thinking, decisive action, and a deep understanding of life-saving medications. The drugs discussed in this essay represent just a fraction of the arsenal available to healthcare professionals in emergency situations. From reversing allergic reactions and heart rhythm disorders to managing seizures and opioid overdoses, these drugs play a critical role in saving lives. However, their effectiveness hinges on timely administration, appropriate dosing, and careful monitoring for potential side effects. Continuous education and hands-on training are paramount for healthcare providers entrusted with administering these powerful medications. By staying informed and prepared, we can continue to make a difference in the lives of our patients, even in the most challenging of circumstances.